perhaps we can actually talk a little bit about the management of acute GVHD. So at our center, we typically use corticosteroids as the first-line therapy for acute GVHD, and we generally start at a dose of 1 to 2 milligrams per kilogram of body weight for recipients. For individuals who have skin disease only, we sometimes use lower doses, such as 1 milligram per kilogram, but by and large, the standard of care at our center is 2 milligrams per kilogram. There also is a role for topical therapy for the skin, using topical steroids or topical immunosuppressants, and even topical steroids for the intestinal tract in the form of non-absorbable oral steroids. How often do you, or how long do you treat patients for with acute GVHD at those high doses of steroids?
Well, that's a critical issue, and despite the fact that we've been doing transplantation for 40 years, the exact dose and exact schedule are really not well established. What has been accepted as a criteria for steroid resistance are people who deteriorate within 3 days or who don't respond within 7 days. For those patients who are improving, we generally will continue them on a dose until the starting dose until things are under decent control. The rash is mostly resolved. The diarrhea is substantially better. Typically, I will continue them on high doses of steroids until their stool is starting to form, or at least has become thick enough that it's no longer dysentery or pure water-like. And then we taper something like 10% per week or something of that order. We can talk about investigational approaches subsequently. I think there's some limitations to the definition of steroid resistance in that if you think about it, if you were to denude somebody's intestinal tract by some mechanism that you could stop instantaneously, how long would it take for the diarrhea to go away? And I think it takes longer than a week for most people, certainly people with severe graft-versus-host disease. And what that translates into is that we often make the assessment that the person has failed to respond to steroids prematurely. And this results in the piling on of additional immunosuppression or the initiation of investigational agents prior to the time that the patient really needs this additional treatment. This is, in fact, one of the places that the biomarkers may be helpful because that's exactly the type of person you want to identify, the type of person who is likely to go on and develop severe GVHD that has an underlying mortality versus those patients in whom, even if the initial manifestations are severe, are likely to respond and get better.